Good morning, parents and family members. I'm Gabriella Maffei. I'm the proud superintendent of Garden Grove Unified School District. We'd like to welcome you and thank you for attending this webinar, which will provide an overview of all the health and safety measures in place for our schools as we enter our next phase of reopening. We'll start with introductions. We have joining us today, and we'll spotlight, David, if you could spotlight, our board member, Mrs. Terry Rocco is here with us today. And I think we had President Nguyen, but he's not on this morning. We also have several members of our district leadership team. Presenting today, you're gonna hear from Valerie Shedd, our Assistant Superintendent of Special Education and Student Services, as well as Cheryl Gibbs, our wonderful nurse on special assignment, and a new face that you may not recognize, Lily, our nurse department chair. Since this is a Zoom webinar, we can't see your video, and there won't be any breakout rooms or chat features, but we will have a Google form at the end for you to submit any questions you may have. As you know, in Garden Grove Unified School District, we have a mission and a vision and goals that drive our work and keep us focused on serving our students and families, even with an ever-changing context and continuous change, which we have had for the last 11 months. There's never been a more important time than now to be addressing all of the concerns that we have, not just from COVID-19, but the challenges that it's placed on our school system. Our district and school leaders have remained flexible to adjust our reopening plans to the ever-changing guidance from the state, and we've maintained focus on ensuring that students have a high-quality distance learning experience in the meantime. And that's with guidelines that are provided by the district to ensure specific amounts of time for students to have with their teachers in response to the survey that we did of our families last spring, where we asked them what were some of the things that they liked best and what were some of the things they'd like us to improve. As you know, 33 of our campuses opened in October and November prior to Orange County returning to the purple tier. Prior to the winter break, we transitioned all campuses back to distance learning because of the huge surge of COVID-19 cases. And that was the case in 13 other local districts that did the same for the month of January and into February. Then over the winter break on December 30th, the governor announced a Safe Schools for All plan that encouraged districts to bring back their students, beginning with elementary students, as early as February 16th. Once COVID rates reached 25 per 100,000 residents. The Safe School for All plan came with a funding mechanism and some legislature that's not yet been approved at the state level. However, we adopted the elementary school California Department of Public Health reopening metrics of COVID case rates based on the Harvard Global Health Institute analysis. And that was all found in the document that you see in the top right-hand side. You can find that online. It's from the California Department of Public Health. As I mentioned, here in GGUSD, we plan to begin reopening elementary schools for in-person instruction once that school's local zip code has reached a COVID-19 case rate of 25 per 100,000 residents. Each Tuesday, we receive new COVID-19 rates, and principals notify families of their reopening or potential reopening dates, providing at least 5 days of advance notice to help our families and our staff members to plan. Yesterday, we did receive our COVID-19 data. We were so close and we thought we would reach 25. However, we haven't yet. We have a few schools that are very, very close, and we anticipate that next Tuesday, when we see the numbers, we'll have a number of schools that will qualify for reopening, with the majority of our elementary schools reopening by late February or early March. Secondary schools that have not previously opened can't reopen until we return to the red tier. And then once schools do reopen, they will only close if mandated by the Orange County Healthcare Agency or the California Department of Public Health. As we get closer to school reopenings, this presentation will provide a reminder of the health and safety protocols in place of our schools. Some of you may have children at a school that had already reopened, and this might be very familiar to you. Others, your children have not yet returned to school, and this may not be as familiar to you. So whether this is a reminder and you already went to our October webinars, or this is the first time you're hearing that, We want everybody to have the same information, and there is some new information from our October presentations. With the majority of Orange County school districts open by the end of February or mid-March, and several that never closed, we're confident that we have every precaution in place to prevent the spread of COVID-19 on our campuses. While it's important to understand that we have and will continue to see positive cases of COVID-19 among students and staff, the data shows clearly that the spread of COVID-19 is not occurring on school campuses throughout the county or the state. We know that the best place for students to learn is in the classroom, and our campuses and our staff are ready to reopen and provide students with a high quality education in a safe school environment. To ensure we're all doing our part to help prevent the spread of COVID-19, our parents and employees are expected to submit a daily health screening form via ParentSquare before coming to campus. And I do that every morning as an employee. I just go to my ParentSquare app, I click on it, I answer some quick questions, I take my temperature so I can report what my temperature is, and I submit it. And it clears me either to come to work, or if you're a student, to come to school, or it advises you that you need to stay home because you have symptoms of COVID-19. It's such an easy way for our district to track symptoms with just a few easy clicks. You have to, though, to use this, activate your ParentSquare account. And you might say, I get emails all the time from ParentSquare. But you might get an email or a text message, but not actually have activated your account on the app. And you're going to have to be ensuring that you have that active in order to submit your screening for your child every day. If you have a student who is old enough in middle school or high school, those students can also submit it for themselves with or through your app. Once you're logged into ParentSquare and you're on the app and you're active and you submit your daily screening, then you'll be good to go for your children to attend school, or for us employees to go to work. And you'll receive a confirmation that will either clear your student or provide you with the next steps. The school offices can help you, as well as the public information office. And we have a quick video tutorial that I'd like to show just to highlight some of the basics, and then we'll bring it back.
GGUSD is implementing a daily health screening form through our ParentSquare platform as an added layer of protection to foster safe school campuses. Prior to coming to work or school, all GGUSD employees and students must complete the health screening form. You must be logged into ParentSquare to access the form. But first, you must ensure that you have activated your ParentSquare account. There are several ways to activate your account. You can click on the activation link you received in your ParentSquare invitation email or text. If you do not have an activation email or text, you can visit parentsquare.com/sign-in and enter your email or cell phone to sign up. An activation email will be sent to you. Or you may download the free ParentSquare app from your App Store on your iOS or Android mobile device. Once you download the app, you will receive an activation link via text or email, and the app will prompt you to activate your account. Once your account is activated, you will see the daily screening button at the bottom of your mobile device in ParentSquare, or on the right sidebar on a desktop computer. Now you are ready to submit your daily health screening. Click Submit Daily Health Screening, answer the questions regarding if you or anyone in your household has experienced any symptoms of COVID-19 within the last 48 hours, enter your daily temperature, confirm your signature, and hit Submit. It should take less than 30 seconds to complete. After submitting the form, you'll see a confirmation screen that will give you an all clear to enter your worksite if non-symptomatic, or provide instructions if you do indicate you are experiencing COVID-19 symptoms or have a temperature above the 100.4 threshold. If you're having trouble activating your ParentSquare account, email ParentSquare helpdesk at ggusd.us and someone will contact you to assist. Thank you for doing your part to keep GGUSD safe.
We all rely on one another to keep each other safe. So our ParentSquare screening is an important expectation that we have of all of our families. But remember, we have resources beyond this presentation today. You can always go to ggusd.us, that's our website, and you can find all of this information, including the videos and instructions there as well. And that's enough for me. Now I'd like to introduce our wonderful district nurse on special assignment, Cheryl Gibbs, and she'll walk you through the process of self-screening.
Thank you, Dr. Moffey. The most important thing that parents and students can do to help prevent the spread of COVID-19 at school is to stay home when you're sick. It's always a good idea to stay home when you think you might be coming down with something, but it's even more important now during the current pandemic. Each morning, take your child's temperature to ensure they don't have a temperature of 100.4 or higher. Ask your child how they're feeling each morning. Look at your child. Are they having any symptoms such as fever, chills, cough, shortness of breath, sore throat, or a new loss of taste or smell? If they are, you should keep them home and contact your healthcare provider for further guidance. If your child does not have a fever and is not having any symptoms, you will complete the ParentSquare form before your student comes to campus. This will be a part of your daily routine at home. This chart shows how close the symptoms of COVID-19 are to those of other illnesses. On the left, we see a list of all the symptoms. The remaining columns show the most common symptoms for each illness that's named at the top of the column. As you can see, most symptoms of COVID-19 are very similar to other causes of illness like cold and flu. It's important to determine if someone has COVID-19. It's impossible, to determine if someone has COVID-19 based on these symptoms alone. This is why when you're screening your student at home, you must err on the side of caution and keep the student home if they're sick. Once schools open for in-person learning, parents will need to assist your students with daily preparation to come to school. It'll be important to include a mask, the lanyard, and your child's personal hand sanitizer in their daily preparation for school. There will be no sharing of items at school, so be sure that your student is ready to go daily. Now that we've covered when to stay home and how you can prevent the spread of COVID-19, let's talk about that first point of entry for many students, the school bus. As you know, schools have staggered pickup times due to hybrid schedules, which lead to fewer riders at one time and keep the same small group of students riding together each day. Drivers will take students' temperatures before boarding. If your student has a temperature of 100 or 0.4 or above, a GGUSD caravan will be dispatched and students will either be taken home if it's confirmed that parents are at home, or taken to the school to wait in the care room for parents to pick the students up from school. Students will board the back of the bus first, sitting one per seat. Masks will be worn at all times, and if a student forgets their mask, the driver will have disposable masks available to hand out. Rigorous cleaning will take place with frequently touched surfaces being cleaned twice per day and disinfecting fogger sprayed nightly. Each time the bus is cleaned and disinfected, it will be logged to ensure accountability. If a known or suspected COVID-19 case is identified, the bus will be taken out of service for 24 hours while it's deep cleaned and disinfected. The bus ride is only the beginning of the safety precautions student will experience and carry out each day. Now we'll show you what bus safety looks like in GGUSD.
When schools reopen for in-person instruction, bus transportation will be available to Garden Grove Unified Schools District students. A variety of new health and safety procedures will help keep students safe when riding the bus to and from school. We're creating this video to illustrate the new bus safety procedures that will help minimize exposure to COVID-19. For the purpose of the video, bus drivers will play the role of students to help demonstrate the safety expectations for all passengers. Because school start times will vary and each school will have fewer number of students on campus at one time, the number of bus passengers will also be reduced. Staggered start times will help ensure that the same small group of students ride the bus together. Bus drivers will use no-touch thermometers to perform daily contactless temperature checks on each passenger prior to students boarding the bus. Students with a temperature of 100.4 degrees or above will not be allowed to board the bus. If the student is not accompanied by a parent at the bus stop, a Garden Grove Unified School District care van will be dispatched to the bus stop. At that time, schools will call home to determine if the student can be picked up from the bus stop to return home with their child. If not, the student will be transported by the Garden Grove Unified School District care van to the school to wait in the school's care room while parents or guardians are contacted for pickup. Bus drivers will stand outside of the bus when practical to limit close contact and to instruct students on proper health and safety procedures. Students will enter the bus one at a time and will be completely seated before the next student may enter. Drivers will load the rear of the bus first, moving forward to limit any opportunity of close contact. Students will unload from the front of the bus, exiting one at a time. Bus drivers will be wearing masks, and all students will be required to wear a mask prior to boarding the bus. Drivers will also wear a shield in any instance where 6 feet of physical distancing is not possible. Drivers will have disposable masks on board for students who forgot their mask. Drivers will carry hand sanitizer for personal use, and students will also be encouraged to carry their own hand sanitizer and tissue. Frequently touched surfaces will be cleaned twice per day in accordance with CDC guidelines, including vehicle seats, handrails, steering wheels, door controls, and armrests. Disinfecting will be documented to ensure accountability. A disinfecting fogger will be sprayed nightly as an additional safeguard to ensure buses are sanitized for the next day. Garden Grove Unified School District is committed to protecting the health and safety of all our students, including while they are on the school bus. That's the Garden Grove way.
In addition to parents taking students' temperatures each morning, schools will take students' temperatures upon entry into the campus. Students of a temperature with 100.4 or higher will be sent home. All school offices, health offices, and classrooms will have touchless thermometers. Temperatures may also be taken throughout the day if it becomes necessary. In addition to keeping children home when they're sick, the strongest line of defense against spreading the virus is wearing a mask. The district has provided 2 reusable cloth face masks with the GGUSD logo for students. Personal masks may be worn, but must meet the mask criteria from CDPH, which states the use of gaiters, bandanas, and masks with exhalation valves or vents is not recommended and therefore will not be allowed. With the exception of medical exemptions, for which we have a documented process, all individuals on a school campus must wear masks. Students refusing to wear masks will be excluded from school and can enroll in the appropriate distance learning program. Students in all grades must wear face masks at all times except when eating, when a face shield could be worn if it's possible. This means students must wear their mask when riding the school bus, when entering and exiting school grounds, and when in classrooms. Students must also wear masks when outside on school grounds for recess, passing periods, and sports activities. Wearing a mask is especially important for protection during those times when maintaining a physical distance is not possible. Students must be sure to wear their mask properly. This means always having their nose and mouth covered securely. Do not make adjustments with your hands after wearing the mask unless you wash them first. When you touch your mask, then you can wash them again after you make the adjustments. As you can see on the slide, it's not appropriate to wear the mask without covering your nose or wearing it down around your neck. And never touch any part of your face with unclean hands. Now we'll watch a video that demonstrates how to properly wear a mask. Now that face coverings are required when out in public, you should know how to put on and remove your cloth face mask. Children under 2 years old or anyone who has trouble breathing, is unconscious, incapacitated, or otherwise unable to remove the mask without assistance should not use face cloth coverings.
Before you apply your face covering, make sure you wash your hands. First, you place the ear loops around each ear. Next, put it over your nose and mouth and secure it under your chin. If you have a metal nose piece, mold it to your nose to prevent leakage and fogging up eyeglasses. Be sure that it fits snugly against the sides of your face. It is also important to make sure that you can breathe easily. You should also make sure you are wearing your face covering correctly at all times. That includes not putting the face covering around your neck and not to touch your face covering. If you do touch it, always wash your hands or use hand sanitizer before doing so. Wearing a face covering is not only to protect you, but it also protects others in case you have COVID-19 but are not showing any symptoms. Always wear a mask when you are in public, around people who don't live in your household, or when you can't keep 6 feet of distance from people. You are only protected if you wear your mask properly, so make sure you are wearing it correctly for maximum protection. To remove your face covering, stretch the ear loops with your thumbs and forefingers. Avoid touching the front of the face covering and handle it in areas that do not touch your face. When removing the face covering, keep it away from your face and be sure that the part of the masks that touch your face is now facing away from you. Wash your hands or sanitize them after you remove your face covering and do not touch your eyes, nose, face, or mouth when removing your face covering.
Your face covering will be an important part of your school supply list. It's just as important as your books, pencils, and homework. If you happen to forget your covering at home or if it breaks, one can be supplied to you at school.
For more information on how to protect yourself and others, visit cdc.gov/coronavirus.
On top of wearing a mask, keeping your hands clean is an easy way to protect yourself from spreading germs. Frequent hand washing and hand sanitizing will be a regular part of our daily schedules when schools reopen. Classrooms with sinks and bathrooms will be stocked with soap and paper towels. Depending on the size of the school, each campus will have 5 to 25 hand washing stations. Every classroom and room also has a wall-mounted hand sanitizer, and there will be freestanding touchless hand sanitizing stations across campus. Hand washing stations, hand sanitizing stations, and wall-mounted touchless hand sanitizers are pictured here. The expectation is that we will all do our part to keep each other safe. These are your lines of defense against COVID-19. First, you must make sure to wash your hands or use hand sanitizer frequently. Refrain from touching your face with unclean hands to prevent exposure to germs or viruses. And use good hygiene practices such as coughing or sneezing into your sleeve or your elbow. Maintain a distance of 6 feet from anyone not living in your household whenever possible. Although school and work are often places where we socialize, we must refrain from congregating with others or hold gatherings. And there can be no sharing of supplies or food. You must prepare daily with the items your student will need for the day. Refrain from bringing food to share for holidays or celebrations. And lastly, wear your face masks at all times according to district guidelines. At this time, I'd like to introduce Assistant Superintendent of Student Services and Special Education, Valerie Shedd.
Sorry. Thank you, Cheryl. I didn't realize I was muted. Another way that we can keep our campuses safe is to follow the current rules for visitors, which currently prohibit non-essential visitors onto our campuses. Non-essential visitors are those visitors that include volunteers, parents who have previously assisted in the classroom or attended lunch, or any other activities involving non-student groups. As you see here, essential visitors are still permitted, but they should not be entering campus if they have a fever or are exhibiting any COVID symptoms. Parents are encouraged to conduct all school business by phone whenever possible. Most schools have a help desk with a bell that is located outside of the main office, which is set up to assist visitors outdoors and to minimize close contact. We've gone to great lengths to implement a variety of indoor and outdoor safety measures on our campuses. Signs are placed and located throughout the campus to facilitate physical distancing on pathways and while waiting in line, as well as to remind staff and students about the wearing of their face masks. Plexiglass dividers were added to teacher desks and office areas where staff come in face-to-face contact with students or community members. This is an additional measure to ensure physical distancing. Study carrels, as you can see in this picture, were added to all of our elementary classrooms and to a large number of classrooms at our intermediate and high schools. Shade structures were installed with tables and benches to facilitate an outdoor area where students and staff could meet for class, take indoor activities outdoors, take a break, or any other meetings that teachers and students may have. All classrooms were configured to allow for a minimum 6 feet distancing between students and staff. Outdoor, no-touch water bottle fillers were installed on all campuses to reduce visits to the drinking fountain and to reduce touch points. We also have stringent cleaning procedures in place and have completely upgraded our ventilation systems to maximize the circulation of fresh outdoor air. In our cleaning and disinfecting routines, we use all EPA-approved products. The district has made a major investment in top-of-the-line airless disinfectant sprayers. All campus locations are cleaned frequently. Our custodial staff has been trained to focus on high-touch surface areas. All of our HVAC units are regularly inspected, adjusted, and repaired. All the HVAC filters have been upgraded to MERV 13 or higher. What this means is that all of our filters either meet or exceed the CDC guidelines. HVAC systems have been adjusted to maximize the circulation of outdoor air. Commercial-grade HEPA filters have been provided for the health offices and the care room areas. The food service team has been busy working with all schools to put together a reopening plan to ensure the health and safety of students and staff. Meal service times have been adjusted to school schedules. All meals consist of prepackaged food items and prepared meals. All buffet-style options have been eliminated to reduce touch points and gathering. Meal stations and equipment will be sanitized frequently. A big change this year is that all students eat free, so students will no longer have to touch a keypad or scan a card. This eliminates shared touch points and reduces meal distribution times. And now I'd like to introduce you to our Nurse Department Chair, Nurse Lily.
Thank you, Valerie. Although we have put many mitigation strategies in place on our campuses, we must expect there to be positive cases identified in both staff and students. We have protocols that align with direction from Orange County Healthcare Agency for when a student displays symptoms of COVID-19, has come in close contact with a positive person, or has tested positive for COVID-19. GGUSD is committed to keeping our students and staff as safe as possible. COVID-19 is present and being spread throughout our community by community transmission. This means that both individuals who have symptoms and those that do not, called asymptomatic, have the ability to spread coronavirus to others in our community. This is why we are urging anyone with COVID symptoms to stay home. Knowing there is community transmission of COVID, it is unavoidable that symptoms will develop in students while they are at school. And when that happens, we have clear protocols in place for responding. A student with COVID-19 symptoms will be sent to the care room while transportation is being arranged. We will provide handouts to anyone sent home with CDC guidance for caring for yourself when symptoms develop. We will also be encouraging those with COVID symptoms to contact their healthcare providers and get tested. In the event that they do get tested, we ask they report their results to the school site. Students with symptoms will be informed not to return to school until symptoms have improved and they are fever-free for 24 hours without the use of Tylenol or other fever-reducing medications. We also will be asking that individuals to make a list of anyone they have been within 6 feet of for 15 minutes or more in the last 48 hours while on campus. The list of close contacts will be needed if the individual gets tested and is confirmed positive. These are the guidelines from the Orange County Healthcare Agency that will be used for students presenting to the care rooms with COVID symptoms. It utilizes emojis to depict the various COVID symptoms. The symptoms are separated as low risk and high risk. It also provides an easy to follow flow of events according to the student's situation. Once the care room monitor receives the student, they will contact the parent or guardian to report the student's illness and make arrangements for student pickup as soon as possible. In the event that a student has 2 or more low-risk symptoms or 1 high-risk symptom, the monitor will also contact the school nurse. The nurse will then reach out to the parent to suggest an evaluation by a healthcare provider is needed. When a student may return to school is based on their ability to successfully complete a CDC criteria for return, or if they receive a doctor's note that states they are safe to return. The various scenarios are depicted on the student's symptom decision tree. The student will be sent home with the form outlining their visit to the care room and an explanation of next steps for return to school. For those situations where a student or staff reports close contact within 6 feet for 15 cumulative minutes or longer with someone who has tested positive for COVID, they will be instructed to quarantine at home for 10 days. Testing will be encouraged, and we would ask them to notify the site with their test results. All students that receive a positive COVID test will either leave the site immediately or will not return until they meet the criteria for return. The criteria for return to school is symptom improved, no fever for 24 hours without fever reducer, and 10 days since symptoms first appeared or the date of their positive test. GGUSD tracks all positive cases and consults directly with the Orange County Healthcare Agency, with each case regarding contact tracing and notifications. Now Cheryl will continue to discuss the GGUSD COVID-19 dashboard.
Thank you, Lily. GGUSD remains committed to maintaining transparency with identifying and reporting all confirmed positive cases of COVID-19. The COVID-19 dashboard is accessible on our website for anyone to see. It will show any student or staff member that has tested positive and has been present on one of our campuses. It will not show positive cases of those on distance learning unless they were on campus site for activities such as sports, band, or attending Boys and Girls Club. The dashboard will display those cases within the previous 14 days and does not maintain a running balance of total cases. There are protocols in place to send appropriate notification letters based on each case details. GGUSD follows all privacy laws to maintain confidentiality of all individuals with COVID-19 symptoms or positive test results. There are more than 50 testing locations in Orange County offering free testing to most or all eligible people, and many more through individual healthcare providers. To get tested, ask your healthcare provider about testing. If you have health insurance, contact your healthcare provider about free testing and care. If you don't know how to reach your healthcare provider, call the customer service number on your insurance card. It's up to each individual to verify information and check with the test site regarding the insurance that's accepted and any co-payments that are expected at time of testing. If you do not have health insurance, you may schedule an appointment at one of the testing super sites at the Costa Mesa Fairgrounds or the Anaheim Convention Center. Since new testing sites are added regularly, the most up-to-date website to find all Orange County testing locations, including instructions on how to order a free at-home test kit, is the OCHCA testing website at https://occovid19.com/C COVID-19-testing. GGUSD is planning to offer on-site COVID testing for students and staff when schools reopen. It will be voluntary, and parents will provide prior express permission to allow their students to participate. More details will be shared through ParentSquare. All the COVID-19 vaccines are being distributed by OCHCA in a phased release. The current phase for vaccinations, phase 1A, includes all healthcare workers, first responders, and persons aged 65 and over. The second phase will be phase 1B, and it's expected to include school employees. Phase 1B is estimated to begin mid-February to early March. The current vaccines being distributed by Orange County are not approved for children under the age of 16. Studies and trials are being conducted to develop an appropriate vaccine for children. The Pfizer vaccine is for ages 16 years and older, and the Moderna vaccine is for ages 18 years and older. Although we've been conducting distance learning this year, all California laws pertaining to school entry are still applicable. Students in the first grade must have a CHDP health examination completed no earlier than 18 months prior to or up to 90 days after their first day of first grade. Students entering kindergarten or first grade, if that's their first time to enroll in school, must have an oral health assessment completed no earlier than 12 months prior to or up to May of the current school year. For questions or forms to submit, you can contact your child's school office. All students must have the immunizations listed on this slide for enrollment in California schools, regardless of their grade level. Students advancing from 6th to 7th grade are required to have a Tdap and the second varicella vaccine prior to registration. For questions regarding immunizations of your child, visit www.shotsforschool.org, or you can call your child's school office. On January the 6th of 2021, the California Department of Public Health, or the CDPH, updated their travel advisory in an effort to curb the spread of COVID-19. People arriving in California from other states or countries could introduce new sources of infection to our state. Even interstate travel between states can cause the community spread of COVID-19. Traveling by airplane, bus, or train may increase your chance of spreading or getting COVID-19. Postponing travel and staying home is the best way to protect yourself and others. Californians should avoid non-essential travel to any part of California, to other states, or to other countries that are more than 120 miles from your home. If you must travel, you should self-quarantine for 10 days after you arrive back in California. Next, I'd like to bring back Valerie to share more information.
Thank you, Cheryl. We know that it will take a team effort to successfully reopen GGUSD campuses, and we are grateful to our wonderful parents for your support in helping us create safe school environments. Our caring and supportive staff are ready to have students back on campus and to go above and beyond to provide a smooth transition for families. Many school sites successfully reopened in October and November, and since then we have fine-tuned our district-wide health and safety protocols. From classroom instruction to grab-and-go meal service to custodial procedures, our staff has an unwavering commitment to supporting the needs of all students. That's the Garden Grove way. We will make today's PowerPoint available on the health and safety portion of our website, where you can also find the health and safety reopening procedures at a glance, which is this document that you see up on your screen now. This document gives an easy to read overview about each of our protocols. The webpage URL is listed at the bottom of this slide. So you can take a picture of that. You also will get this slide, and it also is linked on our website. Now I'd like to share a video that we have shared before if you have been in previous trainings of ours. In the day in a life of a student in Garden Grove, it's just a great reminder of what school will look like when we do return to in-person instruction.
Hello, I'm Dr. Gabriela Mafi, proud superintendent of Garden Grove Unified School District, where we are committed to treating all students as our own. As a mother of 3, including a medically fragile child, I understand just how important it is that families know what to expect when campuses reopen for in-person instruction. We want all of our parents to trust that our schools are taking every precaution possible to create a safe learning environment for your children. We've taken our guidance from the California Department of Public Health and the Orange County Healthcare Agency and created very clear protocols to help minimize risk and keep our students safe. To our GGUSD staff members, we know that you are dedicated to keeping students safe, and you also want to feel safe and comfortable coming into work and adhering to new safety practices designed to slow the spread of COVID-19. Our Board of Education shares these concerns, and that's why we've created this video called A Day in the Life of a GGUSD Student to show our GGUSD community exactly what safety protocols to expect when returning to campus.
Since frequent hand washing helps prevent the spread of COVID-19, students should wash their hands each morning before heading off to school. Before leaving their house, parents have checked with each of their children to make sure they don't have any symptoms of COVID-19 and aren't running a temperature above 100.4. Parents must keep their children home from school if they are presenting COVID symptoms or running a temperature. After doing a quick symptom check, parents or students log the results in the easy-to-use daily health screening form on ParentSquare. This can be done from a computer or mobile phone. Schools will also have hard copies of the form available. All students are expected to wear face masks when entering their school campus. Their mask will be a part of their daily school supplies. Schools will provide all students with reusable cloth masks and lanyards to help prevent students from losing their mask. If a student forgets their mask, a disposable mask will be provided. Student temperatures will be checked upon entering the school bus and the school campus. School staff may take student temperatures throughout the day if necessary. Each school has designated drop-off procedures to ensure school entrances don't become too crowded. Throughout the school campus and inside the classrooms, there is signage promoting mask wearing, hand washing, physical distancing, and other healthy hygiene habits. Each classroom has been reconfigured with non-essential furniture removed to maximize space and provide for 6 feet of distance between desks. Classrooms have been outfitted with individual desk shields for extra protection. All teachers will have a plexiglass shield at their teacher workstation and will wear a mask and/or shield during instruction. Students will continue to wear masks while sitting at their desks in the classroom. Throughout the day, students will clean their hands using hand washing stations and touchless hand sanitizing stations on campus. In classrooms, students will either wash their hands with soap and water or use classroom hand sanitizer. While students will enjoy interactive instruction and will share many ideas with each other, they will not share classroom supplies like pencils, Chromebooks, or science equipment. Under current guidance, students in courses like band or choir will refrain from singing or playing wind instruments, but will continue to meet for instruction either indoors or outdoors. Students will also be expected to follow healthy hygiene practices like coughing into their sleeve, refraining from touching their face, and maintaining physical distancing. During lunchtime, grab-and-go meals will be available for those students who are taking their lunch home. These healthy meals are pre-packaged and can be heated up from home. Some students who are remaining on campus for the full day, or supervised programs such as Boys and Girls Club, will eat lunch on campus and will receive hot meals served in takeout-style containers. All students will be expected to wash their hands before and after lunch. When schools reopen, the payment touchpad will be eliminated as all students will receive free meals. During recess or lunch breaks, or while outside for PE, students will maintain physical distancing. Students will keep their masks on in hallways and in bathrooms. In September, GGUSD athletes began outdoor practice and conditioning in a modified capacity aligned to national, state, and county guidelines. Currently, high school athletics is in Phase 2, which limits gym and weight rooms to 10% capacity and requires 6 feet distancing for outdoor workouts. Each high school athlete completes a daily health form confirming he or she does not have any COVID symptoms prior to arriving on campus. Additional equipment has been purchased so that athletes can practice their sport without unnecessary sharing. Most extracurricular clubs as well as one-on-one tutoring will continue to host online meetings. Custodial staff have been trained on specialized COVID cleaning and disinfecting procedures and equipment that adhere to CDC guidelines. Throughout the day and after school, custodians will use high-powered, fast-acting airless spray sanitizers that disinfect with consistent coverage using EPA-approved disinfectants. This leading technology delivers the required atomization to wrap around surfaces and provide complete coverage, ensuring all school surfaces are cleaned effectively and thoroughly. Classrooms, gymnasiums, cafeterias, and other rooms will be sprayed daily or multiple times per day, depending on the school's hybrid model. Extra care will be given to high touch point areas including doorknobs, sink handles, counters, offices, and other common areas. If a student develops COVID symptoms while at school, he or she will be sent to the school's care room. The room will be isolated and staffed by an adult who will determine if the child truly has COVID symptoms and needs to be sent home immediately to quarantine. School nurses and health aides, as well as administrators and office staff, have been trained on CDC guidelines for responding to those who have tested positive for COVID-19, have symptoms, or have had close contact with a positive case. Some elementary schools will have a Boys and Girls Club program with on-site supervision and academic support to help families with young children. All school safety protocols will be implemented during any on-campus program. In addition to the health and safety protocols, schools will place a high priority on caring for students' social emotional well-being. All students have been impacted on an emotional level by the pandemic, and GGUSD schools will launch a Stay Strong initiative with social emotional learning embedded into the school day. GGUSD schools will also continue to offer school-based counseling and mental health support. There is nothing more important than the health and wellness of our GGUSD community. Thank you for doing your part to ensure a safe reopening of GGUSD schools.
From face masks to physical distancing, we must all do our part to create a safe school environment. The most important thing parents and staff can do is to keep up to date on school communication, as details may vary by site. Thank you for your patience during this unprecedented time in education. We trust that you will work alongside us to help keep our children and our community safe.
Thank you. It's one of my favorite videos. Dr. Mafi and David did a great job. I do see a couple hands up in the attendance box, but unfortunately, due to the webinar format of this Zoom, we do not have the chat feature available to allow you to ask questions directly. But we do invite you to visit our Google form to submit any questions, comments, or concerns that you may have, and we will compile them and answer them as best as we can in future messaging. So you cannot click on the screen to access the form, but we have included the URL on the slide. So please take a moment. You can either write that down, type it right into another device. I'll give you a minute to do that. And also, please, as we're beginning to reopen schools, please do not hesitate to reach out to our wonderful principals and office staff for any school-specific questions that you may have. As a reminder, everything that we have shared with you today is on our website at www.ggusd.us. We're so grateful that you all attended this webinar today. We hope that you found the information helpful as you and your family prepare to return to in-person instruction. And we thank you so much for your partnership with us.
Thank you so much, Mrs. Shedd. And again, please feel free to ask any questions on the online form, provide feedback. If you leave your name and information, we can contact you in return. Thank you, Mrs. Rocco, for being here this morning and yesterday evening for our two presentations. These will also be posted as the previous presentations and workshops were on our website. And also don't forget that we also have a YouTube channel with a lot of these great videos posted as well. Thank you so much for your partnership with us, parents. Your children are the mutual reason why we're here every single day, because we care about them, we love them, and we want them to be successful as you do. So thank you so much. Have a wonderful day, and we'll see you soon.